I love some of the work that you've done with PATH. Would love it if you could share with us what that partnership has looked like and how it's evolved and grown.
You know, that's really one of our most well-developed partnerships. It started with a simple project in Kenya where we were helping them use data to help with the HIV epidemic there. It really transformed when we started picking up a project with them in Zambia. The ministry has committed to a malaria-free Zambia by 2020. And so when we talked to PATH about that particular project, we really thought long and hard about what it takes to be a partner in these cases. And we, of course, donated software, but we also made a 5-year, $500,000 financial commitment. And we wanted to make sure that if we were going to join as partners, we joined for the full term to help the Ministry of Health achieve its objective of eliminating malaria by 2020. And what's happened with that relationship now is it's really transformed into a full partnership.
You've kind of taken it to the next level with a CDC-sponsored platform that is part of the global health security agenda, correct?
Yes, we have. Earlier this year, they invited us to partner with them in the Ministry of Health of Vietnam to help stand up an emergency operations center for disease surveillance. And what Vietnam is doing is they're building a national visual analytics system where they collect data so that they can see when disease starts to break out somewhere, and they can go take care of it before it gains momentum and goes global. And the Ministry of Health announced that they found their first case of Zika virus within 24 hours. Wow. Which is pretty phenomenal.
Wow,
yeah.
That is fast.
Yes.
And Tableau's system allows them to do this.
Tableau's system allows them to take data which normally people would see in spreadsheets and have to really comb through to find where the problems are. It allows them to put it into an interactive visual presentation where you just look and you can see what's happening and where it's happening.
That's amazing. That's amazing.
It's great
and
stuff.
you were recently at The Hague meeting with the World Food Program.
Yes, that was a fun project.
And completely different application than what we've been
Absolutely.
talking about. We've been talking a lot about global health applications, but this was on food security.
So the World Food Program has a division called the Mobile Vulnerability Analysis and Monitoring Unit. They're an innovative team within the World Food Program, and what they do is they use cell phones to take surveys from people that they serve. So imagine they're working in a large refugee camp. The old way is they would have to send in staff members with paper to take surveys. What they do now is they actually use cell phones. And so they'll have people call somebody, or they'll do an interactive voice response survey, or they'll do a survey where the person can type in the answer on their cell phone. It's way less expensive. They can do it now in areas that are actually dangerous to send staff members to as well.
Areas like South Sudan.
Exactly, yeah.
Iraq,
Iran,
okay.
right? So they're able to get near real-time data from places that they may not be able to get data from normally. And then they use that data to make decisions about how, when, and where to intervene. In some cases, what you might hear coming out of an area is that they have a food shortage. But if you look at the data, there was one case where they did the survey, they looked at the data, there was enough food there, it's just that people didn't have the ability to buy it. And so if they would have intervened by sending in a bunch of food trucks, they would have destabilized the market. So instead, by using data, they were able to decide they were going to send in vouchers, which let people buy food from local markets.
Great.
And then that supported the market that had developed in that particular place.